Is it getting harder and harder to get out of bed because of that pain that starts in your lower back and runs down the back of your leg? Sometimes every step is uncomfortable. Sitting isn't pleasant, and even sleeping feels harder than it used to. In many cases, this discomfort is related to the sciatic nerve. And the good news is that, for the vast majority of people, this can improve without surgery, with the right care and the right kind of movement. Today, I'm going to explain, in a simple way, why this pain shows up, which signs deserve more attention, and most importantly, 3 safe exercises used in physiotherapy that can help relieve the discomfort and restore confidence in your movements, always respecting your body's limits. A lot of people live with this discomfort for weeks, sometimes for months, trying to adapt. They change how they sit, avoid walking longer distances, start getting up more slowly, not because they want to, but out of fear of making the pain worse. Some people even think, this must be an age thing, better not move too much. And that thought is understandable. When pain appears, the fear of moving comes along with it. But there's one thing you should know. Feeling this kind of pain is common, but it's not something you just have to accept. In most cases, it has much more to do with how the body has been used, or not used, than with age itself. The sciatic nerve is the largest nerve in our body. It exits the lower back, runs through the glute, and goes down the back of the leg. To better understand, picture this nerve like a thick electrical wire that needs space to glide and function properly. When everything's balanced, it works without drawing any attention. Over the years, especially when we move less, some things start to happen. The muscles in the hips and back lose strength, the joints become stiffer, and certain tissues end up pressing on the nerve, like when there's a herniated disc in the lumbar spine. The result isn't necessarily a serious injury, but an irritated, sensitive nerve that starts to complain in the form of pain, burning, heaviness, or a sharp jab in the leg. And here's an important point. In most cases, the problem isn't the nerve itself, but the environment around it. That's why, when we improve movement, strength, and control of the body, this discomfort tends to decrease. And I say this also from my experience as a physiotherapist. Over the years, I've treated many patients aged 50 and up who came into the clinic with exactly this kind of pain. Pain that starts in the lower back, runs through the glute, and goes down the leg. Many arrived feeling unsure, afraid to move, thinking any movement could make things worse. And what I saw in most cases wasn't a damaged body or something with no solution. It was a body asking for the right stimulus at the right intensity and done safely. When these patients learned to move in a controlled way, respecting their limits, the pain tended to decrease, their confidence returned, and daily activities became easier again. One very common mistake I see, especially after 50, is thinking that the best thing to do is stop moving altogether. The person feels pain, so they avoid walking, avoid stretching, avoid any movement out of fear of making it worse. At first, it even feels like it helps. But over time, the body gets stiffer and the pain tends to come back more easily. Another frequent mistake is doing stretches that are too intense and uncontrolled, often following videos that don't take into account age, history, or the level of pain of the person doing them. And then there are those who believe that after a certain age, there's no more fixing it, and that sciatica is just how things are going to be. That's not true. What's usually missing isn't willpower or being younger. What's missing is the right type of movement, done safely and consistently. And this isn't just clinical experience. The main international guidelines confirm this. For example, the NICE guidelines, official health recommendations from the UK that are used as a reference worldwide, advise that in cases of lower back pain and sciatica, movement and guided exercises should be prioritized, and that prolonged rest isn't the best approach. These guidelines are based on large scientific studies and show that well-chosen exercises help reduce pain, improve function, and restore confidence in daily activities, including in people over 50 and 60. In other words, when I talk about moving safely, It's not just a personal opinion. It's what both clinical practice and top health recommendations have known for a long time. The body is still capable of improving when it gets the right stimulus. So, if science and practice show that full rest isn't the answer, what is the right path? In physiotherapy, we work with a simple but very important principle: movement with control and consistency. It's not about pushing hard or feeling pain to make it count, and it's not about doing difficult exercises. It's about choosing movements that help the nerve glide better, strengthen the muscles that protect the spine, and bring safety back to the body. Another essential point is consistency. A few minutes a day, done with focus and regularity, usually bring more results than doing a lot in one day and then stopping. And the most important part, even after 60, the body still learns. It adapts, it gets stronger, and it responds when it receives the right stimulus in the right dose. Exercise 1. Gentle leg movement while lying down. Let's start from a position that usually feels safer for those dealing with sciatic nerve pain: lying down. Lie on your back on a firm but comfortable surface. If needed, place a pillow under your head or even under your knees. The goal of this exercise is to move the nerve and the lower back area gently, without locking up your back or forcing anything. Start by slowly bending one leg, bringing the knee toward your chest, only as far as is comfortable. You can hold behind your thigh or behind your knee. Go with whatever feels best for you. Hold this position for 2 to 3 seconds, breathing calmly. Then, slowly return the leg to the floor. Repeat this movement 5 to 8 times with that leg, then switch to the other. Important notes. This exercise is not about pulling hard. It's not about feeling pain. It's about feeling your body gradually releasing. If you feel any increase in pain going down your leg, reduce the movement or stop. Here, the goal is comfort and confidence, not effort. Before we move on to the next exercise, I want you to understand why we started with this simple, lying down movement. When sciatic nerve pain is present, the body usually goes into protection mode. The muscles in the lower back, hips, and legs get tenser, and any movement feels threatening. This first exercise helps break that tension cycle safely. By gently bringing the knee toward the chest, we create light movement in the spine and hips without impact or load. This improves circulation in the lower back, reduces stiffness, and sends an important signal to the nervous system. This movement is safe. Another key point is that this exercise prepares the body for the ones that follow. It loosens up the tissues, lowers resistance to movement, and reduces the risk of discomfort when we move on to slightly more active exercises, like spine extension. That's why it's not an exercise for pushing limits. It's a welcoming movement, a starting point, a way to rebuild confidence. And in clinical practice, this type of movement is usually very well tolerated by people over 50 or 60, even those who have been in pain for a long time. Exercise 2. Gentle spine extension while lying down. Now let's move on to a very important exercise for those with sciatic nerve pain: spine extension, done safely. This movement helps reduce pressure on the nerve, improve spinal mobility, and ease that pain that runs down the leg. Lie on your stomach on a firm but comfortable surface. If needed, place a thin pillow under your abdomen for added comfort. Start by resting on your forearms, like you're propping up your upper body. Your elbows should be roughly under your shoulders. From there, relax your glutes and legs, and let your body weight help gently extend your spine. Don't force it. Don't push past what feels comfortable. Hold this position for 10 to 15 seconds, breathing calmly. Then slowly lower yourself back down and rest. Repeat 3 to 5 times. Important notes. This exercise should not increase the pain going down your leg. If the pain starts to move upward toward your lower back or lessens in the leg, that's usually a good sign. But if the pain gets worse or spreads further, stop the exercise. Here, the focus is on relief and a feeling of openness, not effort. Why is spine extension so important for sciatica? This spine extension exercise is one of the most commonly used in physiotherapy for sciatic pain, And for good reason. Over time, we tend to get more and more hunched forward. Sitting too much, looking down, protecting the pain, all of that causes the lower back to close up. When the spine stays closed off like that, the space where the nerve passes also gets smaller. That doesn't mean something is broken. It just means the nerve becomes more sensitive and compressed. Spine extension does the exact opposite movement. It helps open up space in the lower back, improves circulation in the area, and allows the nerve to become less irritated. Another important point is that this exercise helps the brain recognize that this movement is safe. Many people with sciatica are afraid to extend, afraid of bending backward. But when this movement is done slowly and in a controlled way, the body begins to trust it again. And that alone already helps reduce pain. That's why this exercise is not about force. It's about decompression, relief, and retraining movement. And that's exactly why it's usually introduced early on in sciatica treatment. Exercise 3. Pelvic lift while lying down. Now let's move on to a key exercise for those with sciatic nerve pain, the pelvic lift. Lie on your back with your knees bent and your feet flat on the floor, about hip-width apart. Keep your arms relaxed by your sides. Before lifting, gently contract your abdomen like you're zipping up a low zipper in your belly. No excessive force. From there, press your feet lightly into the floor and slowly lift your hips, peeling your back off the ground bit by bit, only as far as is comfortable. There's no need to lift very high. What matters is control, not height. Hold this position for 2 or 3 seconds, breathing normally, then lower yourself slowly, vertebra by vertebra. Repeat 6 to 10 times at your own pace. Important notes. If you feel lower back pain or pain radiating down your leg, reduce the height of the movement or stop. If you prefer, you can start by lifting just slightly off the floor. This exercise should create a feeling of muscle engagement, not pain. Why is strengthening so important for sciatica? This exercise plays an essential role in sciatic nerve care because it mainly strengthens the glutes and the muscles that stabilize the pelvis and lower back. When these muscles are weak, the spine ends up taking on more load than it should, and the nerve becomes more prone to irritation. Strengthening acts like a natural shield. It helps the body support weight better, improves posture during daily movements, and reduces the strain on the lower back. Another important point is that strength builds confidence. Many people with sciatic pain avoid moving out of fear. As the body gets stronger, that fear tends to fade, and movement becomes more natural again. That's why this exercise isn't just to ease the pain you feel now. It's also to lower the chances of future flare-ups. It completes the cycle. First relieve, then release, and finally strengthen. Before we continue, it's important to make something very clear. This video is educational. It does not replace an in-person evaluation by a doctor or physiotherapist. Each person has a unique body, a different story, and a different cause behind their sciatic pain. So if the pain is intense, persistent, or comes with loss of strength, constant tingling, or progressive worsening, it's best to seek a healthcare professional. Now that you know these exercises and understand why they help with sciatic nerve pain, I want to quickly talk about something very important. Even with the best intentions, some everyday habits can get in the way of your recovery, without you even realizing it. So, let's go over 3 common mistakes, especially after age 60, that I see very often in clinical practice. Mistake 1. Getting in and out of bed any old way. A very common mistake I see almost daily is getting in and out of bed carelessly, especially when the lower back is already sensitive. A lot of people try to sit up directly, straining the spine, or roll over abruptly without control. And that's exactly when they feel that sharp jab, or even get stuck completely. What most people don't realize is that how you lie down and get up makes a big difference when you have sciatic nerve pain. Here's the correct way, explained simply. To lie down, it's best to first sit on the bed, then turn your body to the side while bringing your legs up together, and only then lie down, keeping your spine aligned. To get up, do the reverse. First roll to your side, bend your knees slightly, Use your arms to help push your body up, and only then sit up. This movement avoids sudden twists in the lower back and greatly reduces pressure on the sciatic nerve. It might seem like a small detail, but for anyone who's ever been stuck getting out of bed, this makes a huge difference. And most importantly, using your arms or taking your time isn't weakness. It's a smart strategy to protect your body. Mistake 2, overdoing walking. The second mistake is overdoing it with walking, thinking that the more, the better. Walking is an excellent activity, but during certain phases of sciatic pain, long walks without breaks can irritate the nerve. That's because walking is a repetitive movement that demands a lot from the lower back. If you enjoy walking, the best approach is to break it up. Walk for a few minutes, sit down, move a little, and then continue. Another option is to alternate with gentler exercises, like using a stationary bike or doing seated movements that keep you active without overloading the lower back. And if walking for just 5 or 10 minutes already makes the pain worse, that's a clear sign your body needs an adjustment, not more pushing. Mistake 3, rushing or forcing the exercises. Many people actually do the right exercises, but they make one important mistake. They do them too quickly or with too much force. Especially after age 60, the body needs time to understand each movement. When someone lifts too fast in the pelvic bridge, pushes too hard into the spine extension, or pulls the knee to the chest too aggressively, the effect might be the opposite of what they expect. Instead of relieving, the body goes right back into defense mode. These exercises work exactly because they're slow, controlled, and gentle on the body. It's not about how many reps you do, how hard you push, or how fast you go. It's about how you move. Doing fewer repetitions with calm and attention to your breathing usually gives much better results than rushing through them without control. Now tell me in the comments, have you ever found yourself doing one of these 3 mistakes I just talked about? Write down in the comments which one you've made, or still make, and let me know which exercise you're going to start today to relieve your lower back pain. This helps other people going through the same thing feel less alone, and it helps me keep bringing you useful, relevant content. I want you to remember something important. Sciatic nerve pain, in most cases, doesn't appear overnight, and you don't need to face it with urgency or fear. What really makes a difference is understanding your body, listening to its signals, and giving it the right kind of movement, just like you saw today. These exercises, when done calmly and consistently, help not only to relieve discomfort, but also to restore your confidence in moving again, walking, lying down, and getting up without that constant fear of getting stuck. And small daily habits, like how you get out of bed, the pace of your walks, and the way you perform each movement, add up way more than most people realize. If you feel that this kind of clear and safe guidance makes sense to you, I invite you to subscribe to the channel. Here, it's not about miracles or trendy workouts. It's about taking care of your body with respect, especially after your 50s and 60s. And stick with me, because in the next video, I'll talk about something that catches a lot of people off guard: waking up feeling stuck. You'll learn what to do while still lying down in the very first minutes of the day to help your body unlock before your feet even touch the floor. If getting out of bed has ever felt like a challenge, this next video could make a big difference. See you there.